This study aimed to evaluate portable functional near-infrared spectroscopy device, also known as fNIRS device, as an adjunct diagnostic tool for bipolar and unipolar disorders while performing cognitive tasks. Regarding the methods, 75 participants were divided into 3 groups, including bipolar, unipolar disorders, and healthy controls matched by age and gender. Hemodynamics in the frontal cortex was monitored by fNIRS during the Stroop color word test and verbal fluency test. The general linear model compared the differences in oxyhemoglobin levels between 2 groups. The receiver operating characteristic graph was generated for each neuroanatomical area. During the Stroop color word test, in bipolar disorder group, the area under the receiver operating characteristic curve of the left frontal polar prefrontal cortex was the highest, while the unipolar disorder group during the Stroop color word test, the AUC of the left dorsolateral prefrontal cortex, right orbital frontal cortex, and bilateral frontal polar prefrontal cortex were greater than 0.7. Neither group has AUC values larger than 0.7 during verbal fluency test. During the verbal fluency test, with the maximum AUC was found at the left frontal polar prefrontal cortex. The optimal HBO2 cutoff was under 0.229 micromole per millimeter for bipolar disorder group. In contrast, with the maximum AUC was found at the left dorsolateral prefrontal cortex during the Stroop color word test, the optimal HBO2 cutoff was under 0.182 micromole per millimeter for the unipolar disorder group. In conclusion, assessing hemodynamics during Stroop color word test using portable fNIRS offer a potential as an adjunct diagnostic tool for mood disorders in low-resource environments.